It's the cold hard truth. Everyone really want to know what's going on with her show. Just get on the air and you will know it's Sandra. The queen of the mile road is here, helping people from everywhere. Get on the phone and you will hear Sandra. Now she will tell you how it goes, but don't you ever step on her toes, 'cause you will hear the cold hard truth from Sandra. They say she's the hero in town, helping people from all around. You get a call, your money is found, it's Sandra. Some will call her late at night just to say that there is a fight, and she will not just leave it alone. She'll get up and call on the phone, and when politics starts on her show, everyone really wants to know the way the things will really go with Sandra. Some will start to criticize, get on the show and tell pure lies, but someday we'll realize it's Sandra. And when they start to argue again, she'll put the heads to the wind, and soon you will be a friend of Sandra. 'Cause every day everyone wanna hear from Sandra. Every day, everyone wanna hear from Sandra. 'Cause every day, everyone got to hear from Sandra. 'Cause every day, everyone got to hear from Sandra.
Good morning, good morning, good morning. Happy Monday. How is everyone doing this beautiful Monday morning? Hope you guys had a safe and wonderful weekend. We saw quite an accident last night by the yacht club, going into the yacht club roundabout. We haven't heard of any serious injuries in relation to that, so we're hopeful that everyone is okay. And wow, I just saw some additional footage of the same accident this weekend. And when I first saw it last night, I did not realize it was so bad. So I hope everyone is okay. And all I can tell you guys is you've got to slow down. Like, I'm not sure how you total these cars in the manner in which they're being destroyed. But it has to be, you know, it really, really has to be that there's just bad driving involved here. I don't know what else. I don't know if alcohol was in the mix or what, but it's absolutely shocking. Really and truly. But anyway, we've got quite a serious discussion this morning that we're going to be having. So let me first prepare our links to send out, and then we're going to do a deep dive into today's discussion. So thank you guys so much. I see a number of you already here on the live. So thank you very, very much. So just give me one quick second. I'm going to get this prepared for everyone here today. So everybody had a decent weekend. Rolling right through Women's Month. There was a International Women's Day fell on the weekend, and I hope that some of you had the opportunity to enjoy some of the festivities. The Ministry of Youth, Sports, Culture, and Heritage put on a brunch yesterday at the Kimpton that I heard was well attended, and very, very nice. And I saw some photos from someone who attended, and they said it was enjoyable. Number of speakers on the panel, and they quite enjoyed it. So thanks so much to that ministry for acknowledging the important role that women play in our communities, and doing a number of events, you know, yeah, doing a number of events over the course of, let me just mute that, sorry, over the course of the month, really, to acknowledge and celebrate women in our communities. So, yeah, fantastic. All right, so let me just refresh the links. Let's see here. Good morning, Mr. Robert. Robert is in the house. Let me just turn down my mic just a little bit. Seems. Oh, hold on. Let me mute this. I thought I had court this morning, but now my lawyer's telling me no. So I don't know. I never know when I'm supposed to go, to be honest, because things change. I'm just here for it. I just try to show up when I'm supposed to show up, but I'll tell you guys about it later on, because I had a bit of a premonition about it. Let me put it that way. And so afterwards, I'll tell you guys what the premonition was. I don't want to talk about it now because it is a jury trial. And so I'm not really supposed to say much about it. But after I tell you, just remind me to tell you about it, because I do forget these things. So just remind me to tell you about the premonition that I had in relation to this trial. And then, of course, by then we'll know if it came true or not. All right, Robert is in the house. Damaris, Deborah, Jonathan Israel is here. Good morning, Jonathan. Sue McLaughlin is in the house. Irvelyn, Strong-Willed, and many others. Gone over 100 folks already and more logging in now. Big shout out to our Instagram listeners. No, we are not on TikTok. I know somebody thought we were last week, but I'm not sure what feed they were looking at. I think they're looking at the new vertical layout, which is on Facebook, and not Facebook, it's on Instagram. So maybe they were confusing Instagram. It was Instagram and YouTube that now you can view vertical. So YouTube has both vertical and horizontal, and then Instagram is just vertical. So I think they were kind of confusing Instagram and TikTok, two very different platforms. It's easier for us to do it on Instagram, but we don't have the option to go live on TikTok quite yet. Okay, so listen, this is going to be a difficult conversation today. I'm just pre-warning you. And let me tell you why, right? Why is Sandy having this conversation? There's certain things that I don't entirely enjoy talking about, but they become necessary because in a community this size, there's a lot of information that circulates. There's a lot of misinformation that circulates. And at times, somehow we are kind of here, a lot of times, making observations and being very, very cognizant that I actually know more than the average person. And because I know more than the average person doesn't mean that I know everything. But the average person knows even less, if that makes sense. Yeah. So I am a lot of times engaged with different levels of discourse. And I, yeah, I know quite a bit. So let me back this up. I just want to say that this is not even a conversation that I would really like to be having this morning. But when people put certain things in the public domain, and then, you don't address it, The bit of information that is in the public domain is all that is then heard. Yeah. And then that becomes misinformation because people think, oh, wow, this is the story. This is, what's going on. And this is horrible. And when it impacts people's reputations, I think that unfortunately, that's never a good thing. Okay, what on earth is Sandy talking about? All right, let's back it up. We have a young lady in the community who is in dire need of some assistance, right? You guys probably saw the GoFundMe page circulating to help this lady who apparently is in need of a liver transplant. And of course, anytime we hear of someone in need, we are the first ones, quite frankly, to want to jump up and say, yes, let's see how we can help. What do you guys need? So last week we started getting requests. This is a single mother of several children. And we started getting requests for assistance, to help her. And I must say, I was really taken aback that such a young lady, otherwise looks healthy, would even be in this predicament, but not wanting to pry, you just don't ask those questions. You say to yourself, just help where you can. So there was a call for a significant amount of money, over $300,000. Quite frankly, these things are not cheap. I've never had to personally deal with transplant situations, but I do know that they're not cheap. It's a very expensive endeavor. And it is really unfortunate that we don't have transplant facilities here in the Cayman Islands yet. And this is one of the things that I am going to address because I think that the Cayman Islands government needs to now step up to the plate. We've been talking about transplants for a minute. And so why haven't we had the availability of transplants? Now, it's not an easy thing to put into place. And I think there are concerns about, are people going to be stealing each other's organs and all this sort of stuff? And those are valid concerns because there are areas of the world where I suppose that happens, okay? Without a doubt. So you have to put protocols in place, but there's lots of people, lots of countries around the world that have transplant opportunities, even when on your driver's license in the States, for as long as I can remember, even when I lived there and I had my driver's license, I was a donor. So on my driver's license, it indicated that if heaven forbid something should happen to me and I'm in a car accident, I'm one of those people who wanted to give my organs to people who are normally on very, very long waiting lists. So I had no issues with that. I'm like, yes, I'm a donor, include me in this. So we seem to be lagging here in Cayman, and I don't really know why we're lagging, but we are. And it's not good that we've made no significant steps in relation to transplants. There's some transplants that, in fact, are what we call live transplants. So in other words, the donor doesn't have to be deceased. And it just so happens that liver transplants are one of those, right? Because apparently your liver can even regenerate to some extent. Like from what I understand, how you do a liver transplant is you can take a portion of somebody else's liver, and then basically what you take, that can grow in layman's terms, right? And so it is, it is something that we should have moved. We should have moved on. There's been no significant movement. And this is unfortunate because, to be quite frank and honest, this young lady right now would not really be in this predicament, sort of, and I say that with a caveat, but she would not really be in this predicament if there was an opportunity to have a live transplant here done in Cayman. There are facilities here that are able to do it. And she actually does have a relative here who may be a match for her. I think that they've already established that a match is there, right? So what has happened here, and why are we even having this conversation? So this young lady worked for Polar Bear, and Polar Bear, I'm going to do a big shout out to them. They have, been trying to do everything in their power to make people aware of her predicament and to get as much fundraising and as much money as possible, because her life has now sadly come down to dollars and cents. We're going to talk about why that is. And I do have an expert here. I'm calling her an expert. And I think she knows a lot more than the rest of us. So that would qualify her. Certainly, she's worked in the industry for many, many years. So we'll introduce her here in a second. But I think that certainly that question needs to be answered. Healthcare can be expensive. It literally takes one health emergency in your life to wipe you out financially. And this is not something that we need to take lightly or that we should discard in any way. To help lighten the burden, we have a thing called health insurance. And we're going to get to that this morning. And we're all hopeful that, through health insurance, we are able to survive not just whatever ails us, but actually survive financially, and that we don't go completely bankrupt as a result of an illness. Well, I'm here to tell you that is still very much a possibility. If you have, and it doesn't have to be some of what you think, anything, cancer, heart issues. We saw a baby recently needing several $100,000 for heart surgery. And when you have these policies that are very, very limited, wow, it's called a SHIC plan. It should be called the shit plan, because I can tell you what, it is, if you have a serious illness, that's not what's going to really cover you, is what we now know. So her employers, and I'm really, I know the family and I know their heart is probably absolutely in the right place, and they want to assist as much as they can, because the plan that they have, which I'm a little bit surprised that anybody in a group actually has this plan, but we'll talk with our health insurance expert here in a second. Their insurance is just basically that piss poor that, it's not going to cover her for this transplant. Okay. But let's back it up a little bit. That is an important conversation, but that doesn't really need to be a conversation that we should be having this morning. But for the fact that one of the people who is trying to actively help with fundraising has decided to take shots at the hospital, which happens to be Health City that she's at. And this is where now I'm having to have a discussion. As you guys know, Health City is a client of mine, and I'm not here to defend them because they're a client of mine. I'm here to defend them because a lot of times I see situations, especially in social media, where people are having commentary to make and they're making accusations specifically against Health City. And I've had this conversation with them because I know for a fact that what is being said isn't 100%. It's inaccurate. They've always, if I call them and inquire about something, they say, listen, our records are open to review. Because they have this JCF accreditation, they really have to really toe a tight line. And they said, our records, we are happy to have anyone in the medical profession who is qualified to come in and review what we did in any particular case, and then tell us if because this is what the JCF people will actually do, tell us if we follow the correct protocol, if we've done everything that we should have done in a timely manner, et cetera, et cetera. I think that what happens is it is very, very easy for people to throw out negative commentary on social media. Hey, we know we're in the space. It happens. We get it. We sometimes are part of that discourse. But when it comes to actually backing it up, that's a whole other situation. I'm of the opinion that some of these people need to take y'all on. When you say these things on social media, and you can't back it up, and you are just in your feelings, but it's having a negative negative impact on these organizations. Listen, it wouldn't be me running Health City and allowing you guys to get away with it. One lawsuit slapped upside your head would teach you that you cannot go around saying the things that you say without any evidence. You don't even have all of the information. And you're making an organization that has literally saved countless lives in this country look bad with no credibility behind it. And that's a problem. So when you post something like this, for example, I'm going to go to bat and say, what on earth is going on here? So listen, Amy posted this. I like Amy. She's a nice young lady. But I think in this instance, Amy Mobley is completely out of line for this story that she posted, where she said, I wouldn't send my worst enemy to Health City. Amy, maybe this is one of the failings of youth. I don't really know. I know that you're in your feelings with this situation and you're trying to get this lady as much help as she can. And maybe that is somehow taking a toll on your mental, I don't even know. That's obviously taking a toll on you, right? And I get that. But what I don't understand is how you think that this is the sensible and proper and correct thing to do, because it simply isn't. Here's what I want you guys to quite frankly understand. And that's why we have to dissect what is happening in this specific case, okay? That is quite a shocking statement to make. As many issues as even the HSA has had, I don't think that I have ever made such a shocking comment about the HSA in terms of, I wouldn't wish my worst enemy to go there. Well, they have their problems, but I mean, they still help a lot of people and they save a lot of lives. If I have a choice between the two facilities, I would probably choose Health City. I would choose Health City, as I just did, for example, with my orthopedic surgery, over HSA. And I'm not trying to kill the government hospital, because they are the government hospital. And like I said, they've got issues that they need to fix. But when it comes to the numbers, and you look at the numbers that are independently verified, right, by external examiners, if you will, in the medical profession, making this statement this is the kind of statement that should get you a lawsuit. I'm totally serious here. If I were advising Health City, she'd be getting a letter from our lawyers today. But I think they take a very soft approach, and they're more focused on just focus on patient care and let our numbers speak. But this is not it. Now, here's the thing. Despite the fact that her employers are doing their best to raise money, and that's fine, that's wonderful. I think that's great. They're not her next of kin. And so there's a lot of information that they're actually not privy to, because her next of kin, who lives here in Cayman, has not given any sort of authorization or release for them to be able to get the information. So yes, they may be talking to the doctors, but the doctors are not going to tell you every single thing about this case and this situation. For example, right? I have spoken to a number of people connected in multiple ways to this situation. I have to wonder, when Amy put this up, and she continued, it wasn't the only thing that she said. She put up a post, she needs help because the facility, they're not moving as quickly, and to get her off island. Okay, let me just break this down, all right? If there's anyone in the community who knows a doctor who has experience with patients who need to be transported off islands for a transplant, please contact me ASAP. We don't believe the hospital is doing enough, and we are working to find some competent doctors who have a bit more urgency and knowledge. Like, WTF? Are you serious? Are you actually serious right now? You're looking for more competent doctors. So let's call out, does anybody, know a doctor who experience with patients who need to be transported off for transplant. Show me which one. And I see some people commenting here, right? How many of these physicians have ever had any experience with a transplant whatsoever? Where would they be getting it from? Okay. So I don't know who Dr. Cuff is at 7 Mile Clinic, and I'm not taking anything away from these individuals, but where did they get this sort of expert knowledge in Cayman? I'm not talking about where they came from, because you're in the Cayman Islands and you're trying to get a patient off of this island. And that's a very different situation than being in the UK, the US, Canada, Timbuktu, wherever else you may be getting a patient overseas. Cayman does have some unique elements to it, and we need to have this discussion, right? So you put this out there and then you follow it up with this kind of post, and it doesn't take long for people to put 2 and 2 together. Obviously, most people in the community know exactly where this patient is. But Amy, let me be very, very clear here. Is it fair for you to put this sort of comment out there? Leave this in the women's group in Cayman. It's probably still up there today, and not inform people of some of the really critical things with this story. Number one, let's talk about the SHISH insurance plan that you guys have put in place for your employees that doesn't cover her, okay? That is the single reason why she's in this predicament right now. If she had adequate coverage, things could have moved a lot smoother, and you wouldn't be spending days trying to get together $350,000 for even the possibility of being able to send her overseas. So the biggest issue here, and that's why I have an expert around insurance in the back studio, we're going to pull in here in just a second, is around the insurance policy that you guys have decided to choose for your staff. So I'm just saying, I mean, if you want to be upset and you want to blame somebody, maybe you need to look at, wow, why did we choose this insurance policy that's not even to cover workers, especially if a large degree of our workers are foreign workers? It's a question that needs to be answered. Okay. Here's the other thing. I noticed with interest that there were some, and thanks Lizette for being in the comment section on this one and being willing to help. But I must tell you that I found that a little bit contradictory, because she was actually transported from your hospital. I mean, forgive me here for asking the question, but if the Health Services Authority, the HSA, was in a position to help her, why didn't they do that from the first instance? You guys had her as your patient. You transferred her to Health City Cayman Islands because why do you do a transfer? Oh, we can't help her. Sorry, we're tapping out. Not for nothing, but I low-key have an opinion about them tapping out in certain cases when they can't figure it out, they can't whatever. They just hand them over to Health City and then, oh, they're going to die. And then everybody in the community is going to be like, wow, how is it that Health City is getting all these patients are dying? Well, they're coming from HSA because HSA can't help them. Okay. So you shouldn't get in the comment section and be like, oh, I'm going to speak to your mom and see how I can help. Really? If you could help, you should have kept her as a patient and helped her from there. Don't transfer her to another facility and then be like, oh yeah, I think I can help her. That don't make no sense to me. I'm low key sitting here going, what the hell? Okay. Right. Now, also, here's another bit of information that I think needs to be answered, and the community has a right, since this is such an urgent request, the community has a right to know this. What did the HSA diagnose her with? Is it not factually that the HSA actually got her diagnosis wrong before they sent her to Health City? And then Health City has to run other tests and figure out what is really wrong with her? I mean, this is so rich. This is the kind of foolishness that I am sorry. You have to be fair when you discuss these things. You have to be fair. If you're going to attack someone's character, come with facts. Don't you think it would be really, really important to know that valuable time? Now you guys are thinking, oh, you're moving too slow. And yet Valuable time was actually wasted, if we could use that term, right? Because the initial diagnosis from HSA wasn't what the woman had, none at all. Okay, that makes a difference. Before you make this really damning commentary about you wouldn't want to send your worst enemy to a facility, maybe what you should be telling people is the diagnosis in the first instance, before she even got to Health City, was incorrect. And they have to do their own testing to come to a correct conclusion about what is actually happening. But it gets better. That's not it. It gets even better than that. Here's the better part. When she gets to Health City, that crappy insurance company that y'all working with, Cayman First, I'm disappointed, but I shouldn't be. They turn around and deny coverage outright because, oh no, she has a pre-existing condition that has led to this issue with the liver. Really? Y'all need to go talk to your insurance company. That's who's been wasting time and costing this woman her life. You don't need to be getting in your feelings about no medical facility, certainly not Health City. Go and get upset and in your feelings towards Cayman First. Cancel your policy with them and get yourself a decent corporate insurance plan. That's what you need to do. You're aware of this fact, I'm sure, right? That they denied her coverage, that they tried to say she had a pre-existing condition. And the same people now that you're trying to lambast about they're not doing enough and they're not moving quick enough were the same people who had to turn around Health City and convince insurance company that they're actually erroneous, that they were wrong. Cover this woman. Huh? Why don't you talk about the fact that you're talking about you're not going to send your worst enemy there, but this same hospital has not taken a single dime from anyone in relation to this patient. And I'm sure the bill is hundreds of thousands of dollars already. All the testing, everything. Why don't we talk about the fact that unfortunately for her, she's from a country, Zimbabwe, that she can't have every option to go anywhere she wants for the transplant. She cannot get a visa to go into the United States of America. They wasted time with somebody giving them misinformation. Oh, they can get into Puerto Rico. How much time did that waste? So while you're talking about the hospital, you need more competent doctors who have a bit more urgency and knowledge. That isn't the truth, is it? It's your insurance company that is the problem. Who is responsible? And I'm going to ask this from our insurance guest here in a second. Who is actually responsible for making the arrangements for a patient to go overseas? Is it not the insurance company? Huh? It's not the doctors. They're responsible for making sure they have all of the relevant information about the patient's medical condition in real time as much as possible. All of the tests. This is what's going on. That's what's going on, right? It is your insurance company that you should be asking that question of, not questioning competent doctors who you want to have more urgency and knowledge. What do you expect them to do? Because the first question that these people ask, even before you can call and reserve the air ambulance, is ring, ring. Hello, we would like to send someone by air ambulance this morning. Oh, really? How are you going to pay for that? You have the money? They've gone through so many countries trying to figure out where this woman is going to go because of her immigration status and lack of insurance, that now they're at the Colombia. But it's not just, oh, we're going to send her to Colombia. 4 hospitals have said no already. Because, okay, we've got to the $200,000 mark with the GoFundMe page. That's amazing. You don't just transfer money to these hospitals and be like, oh yeah, here's $200,000, take care of her, do the transplant. No, they need a guarantee that if this bill goes up to $1 million, someone is going to be on the line and pay for it. And you know what kind of guarantee they want? They want a government-backed guarantee. And guess what? She's not a Caymanian. So the government cannot give her a government-backed guarantee. And so the way that they operate, let's be very, very clear, in that country, they're not Cayman. You're not going to sit in their hospital beds and run up a bill for hundreds of thousands of dollars and it hasn't been paid. Oh, no, you don't. You're on the operating table about to get that liver transplant and your money has run out. You got to $199,000. Your money has run out. They're going to stop and you're going to die on that table and they don't care because that's how their medical facilities operate. So don't get on social media and make all of these negative comments about a facility without sharing relevant and pertinent information, right? And you should also be very, very cognizant and knowledgeable that there are things that are happening in relation to her own health that you do not have at your disposal because you're not the next of kin. So having said that, as you can see, we've identified a number of issues here. Let's tackle the insurance issue, which is critical to this, because this woman would not be in this predicament if she had a decent insurance policy that would actually cover her. From day one, they would have been able to secure a facility. It's the lack of funding that had people scurrying all over the place and trying to find somewhere to send her. Okay? I'm going to invite into the discussion now Miss Aniki Brown. Aniki has a wealth of experience in the insurance industry. She's actually, I want to say an attorney at law because I think that that's right. I think she has been called to the bar. But she has been the country manager for Generali when they were here in the Cayman Islands. And I can tell you that her experience in relation to that makes her an expert in this area. She understands quite a bit about how insurance works, how exclusions work. I mean, I'm surprised that some of these companies are type of things that they are willing to or try to exclude when it comes to coverage. There's some legislative reform, without a doubt, that needs to happen here, right? So I can confirm that Aniki, she also does a show on CMR TV called Books and Bush Tea because she's an avid reader and lover of all things literary. But she was called to the bar of England and Wales as a barrister by Gray's Inn in July of 2007. She was admitted as an attorney at law here in the Cayman Islands in May of 2008. And she later joined Generali Worldwide / International Healthcare Solutions as manager and in-house legal counsel. And she was there for almost 12 years. So she has quite a bit of understanding of how this works. She's also chaired the Health Insurance Standing Committee for the Cayman Islands Insurance Association, really trying to give them and play a key role in policy discussions about health insurance. Put your virtual hands together for Aniki Brown. Did I say Hill earlier? Did I call you Hill? Unmute yourself for me. Sorry.
You called me Brown. Don't worry.
Okay, good.
Good morning.
Good morning. Thank you for coming on because in my mind, this is such a mix-up. But at the center of this mix-up, really, it comes down to health insurance and people having an understanding, because I think I started off the program today saying how health insurance can literally, or lack thereof, or any kind of medical crises can bankrupt you. No matter how much money you have, it can really bankrupt you. And so health insurance is supposed to allow some degree of a cushion for the average person in the community. But I'm looking at it going, does it really? So let's talk about this SHIC program. Like I said, it should be called something else that begins with S, because it is lacking in so many different ways. But first of all, are you surprised when you hear that this poor woman is largely in this predicament because she's on an insurance plan that doesn't even cover enough to get her a liver transplant, and that they were trying to exclude her from the onset?
Well, I don't really know the facts of this particular case, Sandra. So I would want to spend more time really looking at how we got here. And I think the first thing to talk about here is I know that it is very, very tempting when we get into these very emotive and very scary, life-threatening situations to find out who's at fault. right? It's very, very tempting for that to be a place where we go. I remember in my first month at Generali, I came into a circumstance like this with a patient, a client, it would have been of mine, who passed away suddenly in the night. And, the first thing we did was meet with the family, because the family had been told that it was an insurance delay that caused the person's death, et cetera, et cetera. And it's so easy for, blame to be thrown around, liability to be thrown around, because it is scary. And I think that's the place to start. The place to start is we have someone who is very, very unwell.
Yes.
Right. And for any of us who have been unwell, we know that that is one of the most horrible experiences. And I'm going to probably, surprisingly, give a lot of credit to this employer, because they care.
Absolutely.
They care and they are present. And they are.
I can tell you, there's a lot of employers who wouldn't have done even that much.
And it's so strange, because I find that this is something very prevalent in the Cayman family business, to really care about their employees. I would also say to you that in choosing a SHIC plan does not mean that the employer didn't care. And I think that's important to say. There are many employers in Cayman who don't cover their staff. Who do not cover their staff. They send their staff to go and get their own insurance. So I think, at the starting point here is, let's talk about what everyone has done well, right? So clearly the employer has insured their person.
As is required by law. So if there's anyone who's
required by law, but is often breached.
Right. But if people are listening this morning, they need to know that the law stipulates that it is your employer's responsibility to have an insurance plan in place. They pick it. And let me ask you a question before we go any further. Does the employer have the right to tell you which plan you have to get?
Yes, the employer has to make a financial decision as to what they can manage, because and I think that's something we really need to cover. But if you don't mind, I'd just like to take this back a few steps before we get to this, right? I think a lot of our expectations in Cayman around healthcare and healthcare funding come from a misunderstanding of our system. Our system is not new anymore. But when I was growing up, everyone had free healthcare. When my mother came home from university in 1981, I think it was, there were 6 nurses in Cayman, right? I think it was 6. It might have been 9, but it was definitely under 10, right? Our population has exploded. Our healthcare system has exploded. And in order for our healthcare system to explode, we needed to have some form of funding guarantee. Otherwise, we would never have attracted the healthcare expertise that we have, which is why in 1998, I think it was, the law passed requiring for every single belly button in Cayman to be insured. Right? And I think they still maintain that the government would cover Caymanian children up to a certain point, right? And then it changed, and then the employer gained responsibility for all of its employees and their required dependents. So let's start there, right? But there is still an expectation that healthcare is treated as a right. And we can make that philosophical conversation from the outset, right? Because I think that is actually the very difficult starting point that we have to come to in the starting of this type of discussion, right? Because we are not just dealing with who is wrong and who is right, and who has failed and who has not. We're dealing with a philosophy around our healthcare system.
Right.
And in the 1990s, Cayman made a decision that we would no longer be fully responsible as a country out of our national coffers for the healthcare spend of everybody that we had to take care of. We had to outsource and privatize some of that risk. And it was significant. If you actually look at how much government is still spending on healthcare.
Yes.
And they're only responsible for a fraction of the people who are covered or who live in Cayman, you will understand then how big a problem this is, right? So that's the first place to start. The philosophy that founded our system. We had hard choices to make. And I'm gonna make it ugly, right? I'm gonna say it to you in a really ugly way. We had to decide whether or not to put healthcare and access to healthcare in the hands of entrepreneurs, or keep it in the hands of politicians. So when you hear that, when you hear me say that, I can just see that you're processing this from a place, right? Is it in the hands of entrepreneurs, or is it in the hands of politicians? And it's between the devil and the deep blue sea. But the truth is that a decision was made that profit is more predictable than a motivation than politics. And the way that we ended up working this out is balance, right? A balance between the private sector and the public sector being responsible. Right. So what does that actually mean? That means that we have private and public provision of health care.
Yes.
And we have private and public provision of healthcare funding. Yep. Right. So that's the starting point. That is our location. Yes. That is our current location. Right. And there is regulation in the law. There's law and regulation that monitors and determines. And we are one of, I just want you to know, like, we are, as far as I am aware, we are one of the top 4 highly regulated jurisdictions for healthcare and healthcare funding in the world. Right. So keep that in mind. And by healthcare funding in particular, not healthcare. Healthcare, we're not really as well regulated as I would like. But we'll leave that to one side.
So healthcare funding mean health insurance companies.
Health insurance and Cynical and our social network that you access through DFA, which is now being reviewed by the government through the discussion of what is medically indigent, which is a very long overdue conversation. So I say all this to say that a lot of effort has been put into creating a system that works for everyone, that has allowed Cayman to grow, has allowed Cayman to attract employees and businesses to be able to function here. That's the starting point. However, there are gaps in our current system, right? And when I was the chair of the Health Insurance Standing Committee of the Insurance Association, we began a gap analysis of our health insurance system and really what that was. And I think we only published 1 paper of 4, which was the introductory paper. And one of our intentions was to identify gaps in the system as to who the vulnerable populations were. And I think it is very, very obvious from this example that one of our most vulnerable populations in Cayman is our underinsured guest worker.
Yep.
Right. So
absolutely.
And what I mean by that is someone who is in Cayman on a lower socioeconomic position, right? They're making less money. And I want you to understand this part, because that's actually the employee is, even though the employer chooses which plan to put you on,
right?
The employee is often consulted. The employee group is often consulted. And I have seen employees choose or beg their employer not to insure them because they don't want to pay that $200 a month or that $150 a month.
Right. Because they feel like they can't afford it.
They can't afford it, or it's not worth it, or I'll never be sick.
Yeah.
So you have to understand this, the realities at that socioeconomic space. That is a decision. And I find that this happens often in the construction industry, in janitorial, construction, janitorial, and landscaping. Those are like the 3 high risk when it comes to this type of. So I think we need to just acknowledge that this person is starting at a higher level than a lot of people in Cayman who are guest workers that started at, with their employer support, and they're fully covered, even though it's on the SHIC plan. So that's the starting point, right? I think it's also important to, and I think, we talk about the healthcare system and the health insurance system a lot. And I noticed I kind of hesitate because this is such a human discussion. This is such a personal experience for a single person and their family and their employer. And it is such a visceral and highly charged circumstance. And it's kind of hard to now scale back and just be technical and actually give you the technical answer. But that's my job on this show today, right? I'm here as an expert. But so if I come across as a little dry when it comes to the facts of this, I think it's just forgive me. Like I really feel for this family, and I feel for this, for this employer, and I can see them trying to do their best, right? I think everybody in this circumstance is trying to do their best, including the hospital. Now, I wanted to touch on one thing before we get there, right? Before I actually get into the SHIC plan, which is really the purpose of why you call me on. And I'm so sorry. My dog is snoring. He snores straight through my show, and he's gonna snore straight through yours too. Right?
Yeah.
You mentioned that Cayman is so far behind when it comes to transplant facilities and us being able to do transplants here.
No, actually, that's not what I said, because that isn't true.
Okay.
Where we have an issue is that there's no legislation in place to allow for transplants.
Understood.
We have a facility, for example, Health City, who have people in there at their facility who have done transplants, and they are ready to do transplants, and we don't have the legal framework in order to be able to do them.
Got it. Okay, I misunderstood what you said before. Okay, that's fair. That's fair. I'll take that back then, because what I was going to say was that generally speaking, it's so funny because I was listening to Mia Motley on Trevor Noah the other day, and she really blew my mind. And that kind of yeah, it's an interesting one. She made a comment that really threw me. She said the Caribbean is underpopulated and underdeveloped. And I was like, underpopulated and underdeveloped. Of course, I'm in Cayman, so I got very pissed at that statement. But I had to scale it back and think about it, because she's talking in the terms of the global access to infrastructure and facilities and ability to do certain types of things, right? And we are small. It is difficult to regulate something that big, right? And transplants in particular are so high risk. They're so high risk. It is terrifying to think about them actually being done here. In my mind, I'm not gonna like weigh in any heavier than that on that, because I understand where you're coming from.
It certainly depends on the type of transplant, and there are people who've had transplants that live a very normal life for lots of years. There's no guarantee. And I know everybody wants to think that, if this woman gets a transplant, there's a guarantee she would survive it. No, it's like any other surgery. It carries a degree of risk. Certain types of transplants are higher risk than others. This is, like I said, a living transplant. So the good news is she doesn't have to be on a waiting list for years and years, which obviously that wouldn't be a situation that would help her. She's able to get part of a family member's liver. And hopefully her body won't reject it, and she'll be able to regenerate the liver, and we can go from there. I mean, but we can't even really have that discussion. Because there's no legal framework to allow for transplants. So it's kind of a dead issue. Whether
there is or there isn't, I really don't know. So I just want to stay away a little bit from that, because that
I can tell you there isn't. That's why no one here is able to really help her, and why they're forum shopping, as we call it in law, trying to find a facility that can actually do the transplant for her. Her situation is complicated because she happens to be from a country, Zimbabwe, that doesn't allow her easy access, for example, to the US. Right now, we have no options in Cuba because of their dire situation, obviously. I don't know, but I think probably even Jamaica. I don't know if Jamaica has a transplant facility there, but her options are very, very limited. There's not a lot of places in the Caribbean that would be in a procedure to even do a transplant. And so now we're looking at North and South America, and the closest that they have been able to get where they're thinking about it is Colombia, after 3 hospitals, and for Colombia now it's down to a money issue, so it comes back to where we are having this conversation, insurance and money. And so if you don't have the money, if you don't have the money, these countries, they're not playing around. They don't know you. They don't know, okay, you coming from Cayman, we don't know nothing about you and your situation. You can't just transfer money into their bank account, they accept certain types of foreigners and, payment options guaranteed, government guaranteed. The government can't guarantee an expat, that could go into the millions of dollars.
Yeah. So we're back to that vulnerable population, right? We're back now to that vulnerable population.
Big shout out to Dr. Victor Locoy, who's in the comment section. He said, in case anyone is confused by socioeconomic space, another term for that is poor people. Thank you, Dr. Locoy. Just breaking it down. Yeah. So we have poor foreign workers in this country who, as Aliano mentioned earlier, everybody seems to be, or most people seem to be living paycheck to paycheck. They're definitely oftentimes living paycheck to paycheck, and there's no cushion or savings or anything, emergency funds, nothing in the case of a true medical emergency. That's true for most people, to be honest. Even people who are consider themselves middle class, who have nice homes, the bank owns it. They have nice cars, the bank owns it, right? And so
the difference
they have
is
a medical emergency.
Yeah.
The government, they have no help from Cineco. They have no option.
But this is it. The difference is that Cayman in that position has the backup of Cineco being able to step in a circumstance when, and it's through the Department of Financial Assistance at the moment, but I know that they're now looking at changing the law for Caymanians to be able to have access. Now, let's take a look at this law, because I think it's important to understand what the SHIC plan is. The SHIC plan is in the health insurance regulations. Every single company in Cayman is required to sell it. Every single health insurance company is required to sell the SHIC plan. And in fact, the SHIC plan is embedded into every richer plan. So you cannot go below the SHIC plan.
So that's the bare minimum.
It is the bare minimum. And just to give you some perspective, this SHIC plan is richer than bare minimums in lots of other countries because it has outpatient benefits. And because it actually allows you to go overseas if you need to, right? And only if there's nothing available in Cayman. Now, the SHIC plan is I have been covered on a SHIC plan multiple times. Economics put you in a position where you end up having to be covered by a SHIC plan, right? This is particularly as an entrepreneur. Now, I want to talk before I get into the plan itself about the cost of health insurance. Now, coming above a SHIC plan, a health insurance company is in a position to rate your company and give you a price based on either your experience or the experience of the pool that you are in. So let me just back up and give you an understanding about how health insurance works. So imagine I have a money pot, right? You give me some money, this one gives me some money, this one gives me some money. And out of that pot, I now take that money and pay for this person's baby to be born. And you think a transplant is expensive, a premature baby is hella expensive, right?
Been there.
It's a small scary stuff, right? Yeah. So there's, and then so out of this pot, we have to decide how much to put in the pot on an annual basis. When you actually take a decision as to how much to put in that pot on an annual basis, you're taking a look at how much the last year spending looked like. Where did we spend most of that money? Look at inflation, because inflation still exists in Cayman. I know the Health Insurance Commission likes to say it doesn't, but it does. Inflation, health insurance inflation still exists in Cayman, even though we have the standard health insurance fees, because it's driven by more than just the rising costs. It's also driven by utilization and frequency, right? So you add an inflation rate, which during COVID was astronomical. So let me just give you some perspective on this. Once we have rated that, then we decide how much everyone out there has to pay into the pot for the next year's coverage, right? That's why you have an annual renewal. So that is everyone above the SHIC. The SHIC plan is actually a fixed rate set by the government, by the Health Insurance Commission. And only if you are high risk will the Health Insurance Commission give you permission to charge more. And they will tell you the maximum that you can charge on a person who is high risk. I have seen a SHIC plan cost a single person $4,000 a month because they were that high risk, which is crazy when you think about it.
Hold on a second. Say what?
Okay.
Say that to me again, because I need that one to sink in.
So the SHIC plan has a set rate. But if you come in and you are incredibly ill and you are sick and you are high risk to the SHIC plan, the Health Insurance Commission can give the insurer permission to go above the standard health insurance rate, which is like $150 a month, in order to cover that person's care. And I have seen a person charged up to $4,000 a month on a SHIC plan because of multiple conditions. And I will tell you that the person that we're describing right now, and the case that is actually being talked about now, who is going through this horrific medical experience, would be up there in that level of risk, obviously. Right? We're looking at millions of dollars being spent out on that person, potentially. Now, it's scary because so many people in our country are having to be covered at that level. What's also scary is that that base rate has not changed since 2015. So imagine any plan above the SHIC is reviewed on an annual basis, right? So the health insurance provider will take a look at that plan. How is it performing? Are there any benefits that are not being used? Can we cut those off to make them less expensive? You have, and we have a really, really vibrant market. When I say vibrant, I mean there's a lot of competition. So they're constantly competing to try and bring these prices down. But before COVID, a premier plan would cost you $750 for a person on a monthly basis. Do you know how much that costs you now? Nothing less than $1,800.
Then how much?
$1,800 US.
Wow.
Okay, so you're looking at a significant change in our healthcare funding profile. And a lot of things have happened, right? COVID happened. There was a lot of change in 2020, 2021 to the data in the market and even the health profile of the entire country and the world, right? Costs went up because inflation is a huge thing, right? We also saw new hospitals built, right? We also saw an insurance company leave the market. We also saw a rise of brokering in the market, so people became very distrustful of their health. This is my analysis. This is not fact. This is Anniky's opinion. People became very distrustful of healthcare and healthcare funding, and they sought the support of brokers to give them good advice on what kind of decisions to make. So that, of course, the brokers get paid from premium. So there's, you saw these things going up and up and up, and all of a sudden you're paying more than 2 times what you would have paid in 2020 for the same coverage. Right? But this is driven. You have to remember, this is not just something thrown at a dartboard. Every insurance company has to report to CIMA and the Health Insurance Commission, and they have to report how much they charge. Right? They have to report how much they charge, and they have to report how they got there to a certain extent, and to the extent that the regulator understands it. They have to. What would make someone high risk? Multiple organ failures.
Like any kind of pre-existing condition, basically, or
not any kind. Like that type of price is quite specific, and I think it was cardiac. It was a cardiac case. I remember that was that crazy, and it was 2 elderly people that were retiring. So, they couldn't sustain it. And in fact, a lot of people are actually, once they come to the retirement stage, particularly if they're not government employees, which is another reason why we have to start safeguarding our civil service, right? We should only be, I'm not getting into the immigration parts of this, but we need to be safeguarding our civil service because of the retirement costs and covering our people. And they need to be covered. Like, they need to be covered. There's no question about it, but we need to be careful how we do that. So a lot of people who are retiring now in the private sector are leaving the country because they cannot afford healthcare here. Because the older you get, the more high risk you are.
Yeah.
And I want to keep in mind, right? There are some people that even if their treatment costs $5, they are still going to pass away. We have to remember that the underlying part of this is risk. It is not a certainty. Right. And in the case of this very, very ill patient who is very, very vulnerable, and in this heartbreaking case, we have to remember that even if this is not fully funded, she may not make it.
I mean, I hate to say it, but
it's possible. And doctors have to have those difficult conversations.
It's highly gonna happen. Right? It's almost a foregone conclusion, which I know a lot of people don't necessarily want to hear. But here's
I don't know that for sure, but I would say that we have to remember that the underlying part of this is risk.
Yeah.
The underlying part of this is not 100% certain.
Sometimes you're cognizant of when it literally would take a miracle. But here's what I'm thinking about. As you say this, I mean, last week, my apologies, we briefly talked about the comorbidities that a lot of people here in Cayman have. We talked about the STEP survey and how Caymanians are so incredibly ignorant. And I don't say that to be rude. I mean, ignorant in terms of lack of knowledge, lack of information, that we must be some of the least healthy people on the entire planet because of lifestyle. And so when we have 70% of individuals in the Cayman Islands being overweight or obese, and we still have people sitting down questioning why Caymanians are dying, I'm just like, what is wrong with us? So when we have such an unhealthy population, can we also be honest and make this known that also drives up the cost of insurance?
Absolutely. Absolutely. And in fact, actually, there's more to it.
There's nothing that we can do about this. It's like the number of accidents that we keep having, and all of us pay for that, whether you're the one involved in the accident or not. The high incidence of accidents in our roadways mean that we all pay more for insurance premium, insurance coverage for our vehicles. The fact that, you might be sitting here listening to this program and you're making the right decision, so you're not in that 70%, that doesn't mean that you don't pay for the rest of us, myself included, who are in that 70%, because that 70% of obese and overweight individuals, every single indicator, every single marker of our health goes up. Hypertension, cancer risk, heart disease. What else is there? Like everything, right? So the insurance industry is looking at, people are saying that your volume is low. So I don't know if you can get any closer to your mic there.
I am super close, Sandra, but I don't know what's going on with it. Like it's right here.
Okay. Yeah, I don't know either because I can't pump you up anymore.
I'm gonna hold it up to my mouth. How's that? Let's work with that. Is that better?
Yeah. Let me just see if I can edit your mic settings at all.
Yeah, I tried. I don't think I can.
Okay. Denny said yes. That's better.
Okay, good. I'll just hold it here. No problem. I can do that.
Yeah. The only thing is you're getting what we call plosives, where the pop in.
Close now. Got it.
So, there's lots of things here that can increase your risk, but when you have, somebody said there's nothing wrong with your mic levels. So I'm not sure where they're listening that they can't hear. It might be, I do find that sometimes where people listen makes a difference. Mm-hmm. So I'm curious as to where this person who said you sound fine to them. Let me just see where you're listening. And somebody else is saying your mic levels are fine.
Okay.
Just that mine is louder. So maybe I pull mine down. I don't know. Okay.
Yeah, we'll figure it out.
So they said that they're listening on the radio. Somebody else is listening on the phone. That's what it is.
Okay. Got it.
Okay. I don't know. But anyway, so, we also need to understand that this isn't something that's happening in a vacuum and in isolation. We also play a role about a role in the insurance premiums. My apologies that we're paying.
We do, but I want to also we are not the only ones that are playing a role, and that's important to understand. We also need to be very, very, and I'm careful how I say this because I know that there's a lot of political pushback on this, right? But we need to be regulating the behavior of our medical professionals as well. We have a lot of, I remember there was a comment that was made to me on my way out of the Generali family when we were moving away from Generali and closing down, there was a comment made to me by the head of our overseas office that Cayman was the most medicated location that the entire Generali world covered. And that will tell you something about our utilization. It will tell you something about provider behavior. I know that the Pharmacy Act has had an impact on that, but there are other things. There are other parts of. I find that the medical charge out rate is not looked at and not actually pay a whole lot of attention to. And it's weird. I'll tell you what's weird about that, Sandra, is that we have a standard health insurance fee that we pay up to in health insurance. So health insurance is really only impacted by volume, right? So what does that mean? That means that a person is encouraged to come back multiple times. I remember we had to, at one point in time, restrict how many ultrasounds in a pregnancy we would cover. Because if we didn't look sharp, that person was getting ultrasound once every week, and we restricted them to three ultrasounds per pregnancy. So that's the kind of provider behavior that you actually need to keep an eye on. And I don't think we have enough law set up around that, right?
Let me ask you a question. So when you say provider behavior, you're trying to say that the provider is who?
So when I say provider behavior, I mean the healthcare provider. We have very little regulation. Let me give you some context and comparison.
Yeah.
In the United Kingdom, there is a law, a regulatory framework called NICE, right? Mm-hmm. That NICE framework has clinical pathways.
Mm-hmm.
So every practitioner in the United Kingdom has to follow those standards. So if you come in and you're presenting with blood pressure numbers at this amount, you're this age, you're this height and weight, there is a pathway specific to your profile that the NICE, that any physician that you see is going to be using as a standard. That helps in a couple of ways. First of all, it regularizes what is expected of healthcare in the country. It also puts you in a position where if a physician messes up royally, you can sue them for not adhering to the standard, right? Now, one of the challenges we have in Cayman is that we have physicians who are here from all over the world. They are regulated as to make sure they're fully educated and they're qualified to do et cetera, et cetera, et cetera. Right. But we don't have a national standard to hold practice to, right? So, and this is happening also in pharmacy. So for instance, people who are trained on a British formulary are going to act differently from people who are trained on an American formulary, right? So in the absence of regulation and regularization and of how healthcare should behave, and this is the clinical side of it, it is even more diverse when you look at the financial side of it. We are in a country that does not have, where we don't have to deal with income tax, or we're not filing taxes on an annual basis for our businesses. So you don't actually have the same financial standards. Financial standards in Cayman only apply to people who are regulated by CIMA. Right. So we do not have data to even know if providers are behaving well, and they probably are, but we have no way of knowing. But when you actually look at this continuous increase of healthcare costs in the market, you're actually seeing you're seeing what the loss ratio is, because CIMA actually reports on health insurance. CIMA actually reports on health insurance earnings, but they also report on how much they're paying out in claims. So if you're getting a surgery that you don't really need, you're contributing to that problem. But you probably don't even know that you don't need it because your provider has told you that you do. So this is where I say that healthcare providers do need to have some form of oversight and at least have some form of standard to adhere to, right? However, this is not to assign blame in this particular instance, because I feel like this case is one of those cases that is just, no one is going to be happy about how this goes. But do you mind? I actually have a copy of the SHIC plan here for you. You want to pull that up?
Yeah, I think you can. But let me ask you a question in relation to that, because I think that is interesting when you talk about provider behavior, but also it is more, in my humble opinion, more about patient behavior, in that we are used to going to a physician when we feel ill. And I see, we've got some family in the UK, and when I hear them talk about their health care there and their access to it, and how when they try to go to a physician, to get to a specialist requires a lot of work. They can't just go and see the orthopedic surgeon just like that. They have to be sent around the moon a million times, and sometimes that actually costs people their lives. And so from that perspective, I'm not so sure that I want to emulate those systems.
No, you're not wrong. You're right about that. However, let's talk about who's responsible for that. Because remember, in the sphere of healthcare, the person who is least educated is the patient, right? The patient is not a doctor. The patient is also not a financial expert. So yes, patient behavior is always going to drive up claims, right? No question about it. However, where does that patient get their information from? See, this is where I feel like the insurer could do better as well, right? So let's talk about that, what you just talked about right now. Because we're just used to going to the doctor if we get a little pain in our behind. We buck our toe and we want to go to the emergency room. Insurance plans are designed in Cayman to allow you to do that. They didn't used to be. They used to have deductibles that would make you stop and say, do I really need to go to the emergency room with this buck toe? Or can I just go to the pharmacy and take a Panadol, right? That's what a deductible was for. A deductible was to stop you and say, hey, this is probably not something that I need to be spending up to $300 on out of my own pocket before I actually get access to insurance. So there are things that the insurer could do better to inform the patient. There are things that the provider could do better to inform the patient. But you're absolutely right. I think the key to this system working well is an informed patient. No question about it. No question about that at all. Right? The patient behavior is what is going to drive it up. But if you go to a physician and they tell you that you need a surgery to remove a cyst from your ovary because they themselves want to do that surgery because their bank account looking kind of low right now, that's not a good decision. That's the danger of having healthcare in the hands of entrepreneurs.
Okay. So a physician tells you that you're not sure whether they're, need to get the extra money to put the brand new tile down on the floor that the wife wants. So what do? You go to a second opinion and get a second physician. And then if a second physician says yes,
then you go and get your surgery.
But I mean, is the system designed to allow us even that degree of freedom when you think about it? When you think about the cost involved sometimes, and even going to get a second opinion or maybe even a third opinion.
That's where that's a patient ability. The patient has the ability to go and get a second opinion. It does exist. It is allowed. You will have to pay for it. However, if we had regulation in place, that wouldn't be on the hands of the patient. If we had standards that each physician had to adhere to, and if we were actually looking at what their earnings looked like and tying them to medical necessity, we wouldn't be in this mess. The patient wouldn't have that responsibility. That's why I always come back to setting up. We need to build the container so it doesn't leak. We need to be building a container that works. And I think we actually have done very, very well as a nation to balance the private and the public responsibility. And I think that the majority of employers in this country, including the one we're talking about today, they are actually conscientious about making sure that their people are taken care of. Our problem is that there are still gaps in the system. Let me
ask you a question then, as it relates to the way that people treat insurance and access to insurance here in Cayman, right? So I brought this up even as of late last week, where because we have such a foreign dependent workforce, like we're dependent on foreign workers, right? I understand, and I've gotten this information from people in the not directly in the medical profession, but affiliated. So some of the NPOs who help people get access to screening and when they can afford it, health vouchers and whatever. They have said that they know with certainty that there are people who are coming to Cayman because they need health care.
Yes.
So you just said, hold on, because this seems almost contradictory in a way. But you've got people who are leaving here because they can't afford health insurance, but then they turn around and come here in order to get access to medical care. And I'm hearing it a lot. People who know they have cancers come to Cayman so that they can get cancer treatment that in their own countries, neighboring countries, Jamaica, Cuba, wherever, they can't get it. The Cuban nationals that just came recently on the boat, 7 out of 8 of them have been here before. The previous boatload that came, right, and Cayman Brac or Little Cayman, I can't remember exactly where they landed. One guy, it was his 3rd time here.
Wow.
And he expressed to people that he's here because he's not well and he needs medical care. So,
which is interesting from Cuba, right? But Cuba's, I think the state of Cuba right now,
yeah, I mean, it's just horrible. Yeah. So, they know that if they come here, and even if someone doesn't have a legit job for them, as long as they can get access to that health insurance, they will be able to go to the doctor. And in the instance of the Cubans, they're not even going to have health insurance because they're an indigent on the government and the public purse. So, we will put them through a ring of, assessments and so on as part of the onboarding process. So initially, they're going to get checked out. They're going to go to the doctor. Remember last week we were talking about the whole HIV discussion.
This is what I wanted to show you. Yep.
I confirmed that they get tested. They get a full medical checkup. And so whatever is wrong with him, whether he needs dental care now or whatever, he'll get some sort of assistance via Cineco/government/HSA. So
there are 2 different things that we're talking about here. I sent you a document. I'm going to ask you.
Yes,
I can't present anything.
I can't tell which one. Are you able to rename them so I can see which one? You have 2 there.
If you pull up the earlier page 20.
I can't tell which one is which. Let's start.
All right, that's the one I wanted. That's the one I wanted to start with. But we're going to come back to that. Before we get into the document itself, I want to answer that. There are a few things in Cayman that the government is covering. AIDS and the healthcare for AIDS and HIV is a big one, right? We are going to attract people into this country because it is a public program. And another thing that we have in Cayman is the charitable support for a couple of things, right? For breast cancer in particular, but cancer in general. And that's the Cancer Society and the Breast Cancer Society. And we also have the hospice, which is fully run by donation. And
by the way,
we are not being very discerning about who we're giving that to.
Yeah, let me just do a quick plug for hospice for Jasmine. They were out this weekend. I think they're doing a drive right now where they are asking people. So if you see the ladies there with their little bins and it says Jasmine, please give. They were out. I saw them at Cayman Bay and I made my donation at that location. Please give because they provide a valuable service to members of the community when you're, sort of on your last, they're there. And they have supported a lot of Caymanian families in particular. So please, if you're able to give a little something, dig deep and help Jasmine with their fundraising.
So those are the things that are available for Cayman for free. And that is where you're going to be attracting people. People who have lived here for many years, who are simply aging and actually going through their twilight years, and they have hypertension, they probably have a heart condition, etc. They're not going to be covered in the same way. And in many ways, it's we're setting up 2 different health economies in this way. I am very, very appreciative of the charitable donations that have kept a lot of people alive and kept a lot of people safe. But there is a real risk of us, and what you're speaking to now, attracting medical, what do you call that now? Medical refugees
Yeah.
Because we are doing some things right. And I think that's where we actually need to be. We're not all gone to hell. We are doing things right. We just have gaps that we need to close. There's certain things that are being done right. Right?
This listener to the program says, kaboom. By the way, phone lines are open. If you have a question or you want to contribute to the discussion, 936-2626 is the telephone number. But this one says, kaboom. Remind me, Aniki, what time you're good until?
I have another 20 minutes.
Okay. All right. Because the wait time is horrendous in other countries and they could die trying to see a doctor. Dental and optical care is optional in most countries, including the US, and most of our guest workers kill the dental and optical plan.
Yep.
So yes, I mean, I agree with that. And, even people who come from places like the UK and the US still come here and they get coverage. And by the way, I know you didn't really want to politicize this in any way when you started talking about civil servants, but let me say this, the government needs to start thinking about, they tend to have people on as contract workers, i.e. foreign nationals, and they hire these people who are geriatric, past their prime, 60 plus. And I've seen it with prison. The head of prison, poor guy, had a heart attack and died. One of the former prison directors. Mm-hmm. So, I mean, they're hiring these people who really physically couldn't pass a test if they tried to give them one. And yet they keep renewing them and keep placing them and putting them on contract. And those people are having a real issue when it comes to healthcare. The previous prison director, I think he actually, I can't remember if it's the current one or the previous one. I lose track of them because they've had so many. Mm-hmm. But he was a person who was actually out of office for quite some time because he had cancer. And I mean, that's horrible, right? It's absolutely horrible. But he came here with cancer, government knew it, and still hired the man. I'm just like, what? Because now you're talking about how those are the types of things that if he was in private sector, he would be a high risk case, paying $4,000 or $5,000 a month for insurance coverage. The government takes on that burden, right? And he's going overseas for treatments to this center and that center. And we, the people, are paying for it when government takes on the burden. And so they have a track record, right? There's one over in the DPP's office. The dude, former police, has got to be at least in his 60s, if not pushing 70. And, they keep these people on contract like, oh, yeah, now we have an unlimited retirement age. So technically nobody ever has to retire. And that's adding to the cost, too. I mean, I'm not saying that old people should be discarded, but I'm saying government needs to pay attention to the older expat population, especially those who are coming here with pre-existing conditions or unhealthy, and talk about the toll and the burden that is putting on Cineco specifically, the healthcare system that government is responsible for.
And I love to avoid politics, but just to speak to that point really quickly, consider that a person in that position who is not well,
yes,
is on contract, has access to healthcare in Cayman with indiscriminate, pretty much, right? I know that someone was going to argue with me on that, but generally speaking, they have the access to the care that they need. Can you imagine now making them responsible for setting up their own succession plan?
It ain't gonna happen. Yeah, that's why Caymanians can never get in those positions. That's for sure. All right, we do have a caller in the line. Good morning, caller. Welcome to the program.
Good morning, Sandra. Good morning, Annika. Siobhan here.
Morning.
I cannot. Thank you. I'm lying in my bed, pumping my fist. Thank you so much for getting on and breaking it down, particularly for the average person out here using health insurance. Thank you for talking about the butt-soles. We can do such a better job around educating persons about the use of health insurance and how it should be utilized, and is it being used necessary? Is it necessary for you to get a new pair of glasses every year because it's available? I'm speaking to the people who show up at the physician's office because they have a cough when they wouldn't have done so if they didn't have health insurance. Secondly, I want to touch on the SHIC plan. I would call it something else, but we're going to stick with SHIC today. About how inadequate it is, how inadequate that plan is, not just for our guest workers. There are Caymanians who are on that plan. who are deeply, deeply affected by the inadequacy of that. That coverage, I feel, was developed, and in speaking to a few legislators and former legislators, was developed to satisfy a small requirement, largely surrounding guest workers, so that there was some coverage and that the brunt of it, as Aniki said earlier, would not fall to the government, because there's this illusion that healthcare in Cayman is free. Secondly, I wanted to, and I'll ask this question and I'll leave Aniki to answer. In the world over, we have national health care. In those countries, those people pay taxes. The current health insurance system that Cayman currently operates under is that deductible system where I pay some, you pay some, and we have deductibles and what have you, not that 80-20. Right now, health care should be a right, or I should say access to health care should be a right. And with the presence of that legislation that requires, as Aniki said, every ballot button in this country to have health insurance, how badly are we failing? We know for sure that there are children within the Caymanian society. I guess it's easier to regulate foreign or children and foreign nationals and children of foreign nationals easier because of the work permit system, and it's easily trackable and traceable. The problem that I have, and the thing that is a big concern for me, is the number of Caymanians who are going uninsured and who are uninsured. I'm talking about minors. I'm talking about minors who need extreme, severe, and maybe Aniki can speak to this, dental procedures that the physician is saying, this child's, in this instance, mouth is so bad that I can't do a simple extraction. That child has to be put under. They have no health insurance. That physician who has made the recommendation that this child be put under for dental surgery has to themselves, in a lot of instances, doesn't have a parent who can advocate for that child down at NAU, now DFA, to say, look, I need Cynical to cover this Caymanian child because this child is at risk of severe issues. I know of a specific incident where a child had a parent working for government who he refused to cover. See, all of that is a big fat mess.
Wait, just say, not quite sure I'm understanding.
You heard what I said, yes.
So
I was brought in on a situation for
the
a
parent
child,
works for government.
And so the child was outside of the marriage. The father worked for the government. He did not acknowledge the child legally. He was not the child's legal father. And subsequently, DNA test done, determined he was the biological father. And he refused to cover the child, leaving the physician have to fight with NAU. Those are some of the things, and I'm just putting that out there.
That should be a court order right there. I'm sorry.
Oh my God, that's crazy.
That is so upsetting to hear.
That's crazy.
But I'm just it's a good example. How prevalent it is, right?
Yeah.
And like I said, it's easy to track and be able to manage and work around for guest workers who come here and to ensure that they and their children are insured. It's much more difficult to regulate that Caymanian children are having health care and access to proper health insurance, right? But I want to, and I'm going to ask this question, and I'm going to ask this question to Aniki. Sandra, feel free to put your input in, but Aniki being the expert here, the subject matter expert, right? There was some discussion a while ago, I think, about going towards a national health plan, i.e. we're all paying into a system, i.e. we all have access to the same level of healthcare, same doctors, same everything. Do you think that that is a viable solution, given what we see that we are currently facing, given your experience, your expertise in saying that we are one of the most heavily medicated in the Caribbean? We are, in my opinion, probably over-medicated, having these elective surgeries. People really don't, and I won't get into that. People really don't understand the game of insurance, and I don't say game as a joke. I just say, as a business,
right?
Insurance is also a business. They're not in there for shits and giggles. Excuse my language. It's a business, right? And it's a game of it's a business of risk. And your premiums are determined based on your risk factors. Excuse me, and the like. Right, Anarchy rightly spoke to a $4,000 ship plan. You could probably get a premium plan at that cost, but because of whatever underlying factors that you have there, that price is exponentially increased. And some people are paying it just to meet the bare requirement that the government requires in order for you to be in this country, right? But I just wanted to ask that question in her opinion, could we benefit from it? And do we think that, does she, in her opinion, working on the insurance side of things, think that could make a difference to the overall population? And I will just listen in.
That's a great question. That is a wonderful question. I do have strong opinions on that. And I want to start off with the space where you speak to healthcare should be a human right. Now, I have very, I guess I would call it left-leaning beliefs when it comes to healthcare and when it comes to education. Those are two fundamental pieces to a successful society. And in my opinion, healthcare at a very minimum level, at the minimum for medical necessity, should be a human right. That's my personal opinion. However, in the practical sense, we have to remember that we made some decisions based on who should be responsible for making decisions around your healthcare. Should it be an entrepreneur who's going to be making decisions based on profitability, which is relatively predictable, and market features, or is it going to be politics? Right? And I want you to think about that really carefully, because think of the politician that you despise the most. Right? Think about the politician you despise the most. Everybody has one.
Yeah.
You want that person responsible for the sign off on whether or not you have access to healthcare.
Oh God, no.
Do you understand?
He might want it for his freak offs instead. No thanks.
So if you think of that, right? So that is one of the tough decisions that was made at the very outset of creating this system. That's one thing. Another thing to consider, and I'm going to come to this comment, right? Another thing when it comes to this system that we really need to think about is, can our government really be responsible financially for and administratively? Because right now you have to understand that our government, by making sure that we have a requirement for health insurance, we have companies that do this for a living all over the world. This is their level of expertise. They have underwriting expertise. They have pooling expertise. They have actuaries on board. They have resources available to them on an international level that put them in a position to make very, very powerful, strong decisions as to how to manage their portfolios. Now, if we take that in-house, we aren't sure what we're going to get. If we take that in-house into our country and our country's responsibility, we also do not benefit from the international access to care, the international access to pools, because there are companies in Cayman that belong to international pools. So, for instance, the multinational companies that we have, they are part of captives all over the world. Right. Which is why I come back. My answer to the question is this, and the question was, just for those of you who need a reminder. Do I believe that a national health plan is the answer? And I think, we have to remember what a national health plan is. In the form of an NHS, like what the UK has, I don't think so. I do not believe we can sustain that. I do not believe we can create it, especially if we are committed to a tax neutral society. Even then, if we do, we still are going to be putting ourselves at risk of the decisions being in the hand of the politician that we despise the most. Right? Whoever that is for you.
And Lord Jesus, right? We can't have that, folks.
Right? So that's one thing. But I do believe that there are places where we need to do better as a country in regulation and making the system work. We need to be looking, and the talk about the children. No Caymanian child should be without cover. Every Caymanian parent who is employed should have their children covered. That is what the law says. If you are not covered, you should be a client of the DFA. And that is children.
And I understand adults taking risks. Yeah, I think that's just malicious if you have a child. whether you are part of that child's life or not, that you don't have that child covered under your insurance plan. Like, that's just absolutely ridiculous. But this person says, morning, Sandy. I agree with your guest in respect to some of these providers recommending unnecessary surgeries. That problem is probably why there's so many medical providers opening up on our island. They see the financial opportunities without the legal restrictions. Well,
Okay.
I mean, they also see a lot of patients who, so again, this comes down to people. And I mean, we all know of at least one person, I feel like, who's always at the doctor's office for every little thing. I have someone like that in my family. I mean, she's had umpteenth knee surgeries, not to say that she might not have needed, because I think one of them did in fact fail. So she needed a revisionary surgery, but she's that buck toe person. She's the person who wants to go to the doctor for every little thing, regardless of how minor it is. And she's had more hospital stays and more surgeries. Like, I can still count on one hand the number of surgeries that I've had in my life. I feel like most people should be in that position.
I think most are though, Sandra. Yeah, and I think the commenter actually has a point.
Extreme users who hurt the system. And can I just say that most of them are never in a position to pay for it. They're the ones who are always getting the free medical care, free Citco, because they don't want to keep a job. I don't know if they can keep a job because of how much they're always in and out of a doctor's office and whatever. But they're the person who are abusing the situation. Now, I'm cognizant of the time and that you have to leave here shortly. So let me just read a few more comments. This person says employers have to submit medical and police records so they're aware of their liabilities. We are bringing too many people here with medical issues that leaves here with enormous medical bills, and we have to pay with the increase in coverage. To be clear, the minimal medical that's required for immigration purposes is not sufficient, because it certainly doesn't test for all of these comorbidities that we're talking about. It doesn't test for cancer. I mean, they're just concerned mostly with communicable diseases. So that's not a real medical as far as I'm concerned. I mean, let's just be clear. Andrew says health insurance is determined by your health. The underwriters, actuaries determine the risk factors based on your condition. Diabetes, heart condition, high blood pressure are prominent in our Caribbean island. Our lifestyle, drinking, smoking, not eating healthy. So I think we've touched on this. They're all processed foods, no exercise, throwing medication, and charging high premiums for coverage. Absolutely. I know that we are touching on health insurance, but there's also another type of insurance that's critical, and that's life insurance, especially since all of our banks pretty much require life insurance in order to be able to get a mortgage from them. I know for a fact that these life insurance companies are ramming it to us. And again, no sort of regulation or anything there. I'm thinking in particular, some of them who they had offices in Jamaica, they try to, what is it called when they rate you? Is that the right word? Where they want to charge you a higher premium, and they pick up on, and they're like, oh, well, we know. I had to fight with one of them who was coming with some ridiculous stuff. And I mean, yeah, I'm not super fit in the healthiest person in the world, but I'm also not the least healthy. And so things that they were trying to pick up on my test results weren't even there. I had to go back to the physicians and say, you need to interpret this from a physician perspective, because I was not going to allow some underwriter, right, who claims that, yeah, she has a medical degree. I'm like, well, then are you an expert on reading this ECG? You know what I'm saying? Because you're trying to rate me based on what? It came back clean. Mammograms came back clean, this and that, but yet they're like, well, we're not sure. And it's like, what? So I feel like for some of these companies, when you talk about the fact that none of these are solely Cayman-owned companies, right? They all are connected around the region and stuff. They see Cayman as a cash cow, and they are willing to ram it to us and take as much from this jurisdiction, because guess what? They're not making that kind of money in any other jurisdiction.
Okay, so that actually brings me to the point that I wanted to make before leaving, and I want to pull up the SHIC plan before I go so that we don't miss that part, right? Health insurance internationally has been, with the invention of health insurance came some of the most powerful discoveries of medicine. When health insurance came, it created a security around funding for healthcare provision that allowed for the medical profession to take some of the pressure off and make sure that they could actually innovate. And you can see that Cayman is a microcosm of that international development, where in the 90s, we had so very little healthcare available to us, right? The HSA was the main thing. I mean, I was a teenager in the 90s. I remember this. And so with the evolution of our healthcare system to bring in the support of international funding, which is really what health insurance that began like, right? Because it became the private sector's responsibility to cover its employees. That put us in a position where we are now an attractive jurisdiction for healthcare providers, for doctors, for therapists, et cetera, et cetera. As our healthcare funding system has become more sophisticated, it has put us in a position where we access healthcare more easily. And that is something that I think we don't give health insurers enough credit for. And when I say that, I mean that is the industry as a whole, because it's not any single insurer that's responsible for that, but they have created the security for health care to develop. Now, the SHIC plan was part of that. And that is, I think the existence of the SHIC plan can be directly related to why we have so many physicians and so many practices in Cayman. We have 4 hospitals in a country of less than 100,000 people. That's crazy. No other country in the world is like this small. But if you take a look at how little the SHIC plan covered, you have to remember that the SHIC plan was developed in the 90s. It was updated in 2015. In 2015, 100,000 CI dollars went a long way compared to where it does now. Now we are in a place where this probably needs to be updated. And I think it's the challenge with updating something like this now. You can see at the very top, I've highlighted the important parts. In the SHIC plan, you have an individual lifetime maximum of $1 million CI dollars. You have an individual annual maximum of $100,000, and which is where the case that we're talking about is probably going to fall down. Right? What that covers is inpatient, in hospital, including your physician, surgical room and board, and ancillary expenses. That means any blood tests that you take while you're in the hospital, any x-rays, etc., any form of imaging, outpatient surgery, and ambulatory surgical care or hospital. So it's not just inpatient where you spend overnight, but anytime you go under anesthesia. Chemo and radiation are also included as inpatient under this section, as inpatient and outpatient. Maternity, labor, and delivery, major maternity procedures and hospitalization, and postnatal inpatient care, right? And you also, I didn't highlight all of it, but inpatient mental health benefit has a different lifetime maximum. It has a $25,000 lifetime maximum, which is probably less than a 15-day stay. But when you consider the inpatient is up to a maximum of $100,000, you're paying 80% up to a maximum of $100,000 CI. That's called out $120,000 US, right? That means you are responsible for 20,000 of that bill of 100. Well, what more than 20,000? What am I saying? You're responsible for 24,000 US of a bill of 145,000 or whatever it is, right? So you understand my math is not my mental math is not on point here, but you'll see that this is where a patient who needs overseas care is going to fall down, because $100,000 cannot get you a bed secured for a 30-day stay in a hospital in Miami for a transplant. That's just not going to happen. That's just not going to happen. So it's inadequate for that level of care. I feel like this SHIC plan is for a younger workforce. And even then, you're looking at accidents, you're looking at car accidents, you're looking at pregnancies. Which is why I always advise clients, you have to make financial decisions for yourself. And we are dealing with a very stark financial reality, a very, very stark financial reality where an employer cannot afford much more than this. And I feel it for Polar Bear, because they're going to take a beating over this, right? Publicly, because they've chosen a SHIC plan, but no one in their industry is doing anything different. No one in the industry can do anything different. I mean, you're complaining about AC bill.
Maybe you have to think about choices like this when you're in business. And I mean, some businesses are very labor intensive, obviously, and air conditioning businesses are certainly one of them. But if you at the very minimum recruit workers, and I know this is going to sound really, really bad, but this is the reality of employers and how we have to think sometimes. If you at least recruit your staff from regions, right? So if this woman was from Jamaica, her predicament could be very different because at least she has an option to be air ambulance to Jamaica where she could get care in her own country. We are, and I mean, this certainly is food for thought because I think anyone who is now from one of these countries halfway around the world where you don't have visas to be able to get into the US or you're not close enough to be able to be quickly repatriated back home for medical care within an hour or two to get back home, it's like a 12-hour flight to get all the way to Zimbabwe. I've been there, so I know. Right? What are you going to do? Like those individuals now need to think if something happens to me and they need to have a plan in place. If something happens to me as a guest worker here in this country, talk to your family members. What is it that we're going to do? Especially if you're on this SHIC plan. What is it that we're going to do? What's the plan? You know, maybe start to not that you're trying to call, as Caymanians would say, calling down, you know, bad health in yourself, but no, start to check out what your options would be. So right now, if you're here and you're here from South Africa, right? Heaven forbid you get in a car accident, you have an accident out in the water, whatever, and you need to be air ambulance out of here. What are your options and where are you going? There's nothing wrong with thinking about it and what your contingency plan would be. If you're here from the Philippines, it's not that easy to get an air ambulance back to the Philippines. Where would you be going? You can't get into the US. And just because you're having a medical emergency doesn't mean that countries like the US are going to make an exception and allow you in on any type of a visa. It's not going to happen. So where do you want to go? We can't go to Cuba, right? Sometimes Jamaica is an option, but again, it depends country by country and how quickly you could get like a medical visa. So if you live here and you're one of those nationals, I think it's incumbent on you to start thinking realistically now about what your options are. At least think about it and say to your family, listen, we've realized that the only place we can go is Honduras if they have these types of options. And I don't really know of anybody ever being medically Honduras,
absolutely.
It can happen, right? So maybe you look at, you know, is Honduras a country that we can get easily access to, depending on where you're from? Can we go to Colombia? Can we go to somewhere in South and Central America? Start looking at other options. Again, the logistics of, I don't know how the air ambulance routes work, you know, but I don't think they're dictated the same way as commercial flights operate. But, you know, you got to think about how you're going to get there. How are you going to deal with this type of a situation?
Yeah, and I mean, I need to leave you very soon, but the second page I wanted to show you as well before I go, because this was an open question from last week. If you can zoom into that real quick.
I can't zoom in.
All right, I'll just tell you what it says.
But if you send it to me on WhatsApp, I can. That's
okay. I got it. Yeah. So we talked about exclusions on the plan, and I do have one thing I want to wrap up with after this.
Yeah.
On the SHIC plan, there are a number of exclusions, right? And we talked about this last week. Exclusion number 8: treatment for illness or injury arising from or associated with drug or alcohol abuse, self-inflicted injuries, and sexually transmitted diseases. Number 9: treatment for any illness or injury arising from or connected with the human immunodeficiency syndrome. So you remember what I said last week?
Yep.
That's one of the programs that is offered free by our government because it is not covered by health insurance. Now, I want to just come back to you on the piece around, so there are quite a few things to cover this around the workforce, right? We have to be so careful and I'm speaking from an immigration standpoint about, I believe we have to be very careful about protecting our culture and making sure that we're building the community that we want to build, right? So I know that there's discussion and concern about and quotas around nationalities, who should come in, et cetera, et cetera. All of that aside, it is interesting to see people coming from the Philippines and people coming from, I think it was Philippines, Bangladesh, India. Their insurance companies have actually made exceptions to allow people to be flown home there because healthcare there is less expensive on a SHIC plus, but not on a SHIC, right? SHIC is where you're going to find the more dangerous restrictions, right? And so one of the things that we've looked at and as insurers, some of us, not all of us, this is not as an industry, but I certainly was part of the discussion, was extending our coverage area to include parts of the world where our workforce actually lives or came from, right? So I remember I actually designed a plan, and it's a plan that I would love to bring back to market, and I'm working on that, but we'll talk about that another time, where Nepal, Bangladesh, the Philippines, and India were all covered, and Pakistan, I think, were all covered by this plan, because we acknowledge that but this is why it's so important to tailor our coverage to our population. We need to be wise about it. We need to be setting ourselves up to win. I believe we have a system that works for the most part in the majority of instances, and these are the instructive examples of where we need to start closing gaps. And I think my last words for you, because I do need to dip, my last words would be, I encourage this family and this employer. I feel like you have done, you've done the best that you can do in a really, really difficult situation. I think that is also true of the hospitals and the physicians who care for us all. And our goal now needs to be, as a community, to make sure that the tide rises and that we start to close the gaps and protect all of us, because one of us falling through the gap is actually going to impact the cost of all of us.
Let me ask you one quick question before you leave. Whose responsibility is it when it comes to air ambulance and getting someone overseas? Whose responsibility is it to make those arrangements? Does that fall on the insurance company, or is the medical facility responsible for making that happen?
So it is a partnership. In my experience, and I have never really done an air ambulance with Health City myself, right? Because by the time Health City came along, my overseas office did a lot of that. But I've worked multiple times with the overseas transfer office at the HSA. And my experience with that has been that you need to, there's a coordination that takes place. The insurer is not required. The insurer is not required to participate at all, apart from confirming payment. However, many of our insurance companies have what we call third-party administrators. And I think in this case, the insurer that is involved in this one does have a third-party administrator who would be involved in the coordination of care. That entire process would be considered to be the coordination of care. What would normally happen is the attending physician would have to identify the need for the transfer and claim that, and make sure that they identify that it is medically necessary. And not only is it medically necessary, but it is the effective way to treat this particular in this particular instance, right? There is hope for this case, for instance.
Yeah.
That physician needs to sign off on that. That then needs to be sent over, and a bed needs to be identified.
Let me I know you got to go. So
no problem.
Let me ask you on this point. What I've just heard you say, right? If there is no hope, so say, for example, a patient is more likely to die en route, or, shortly thereafter or during the transplant, because the body isn't even well enough to do transplant surgery. Are you saying that if the physician in Cayman has come to that conclusion, they shouldn't even be air ambulanced out of here?
The physician will make the determination as to whether or not the patient is stable enough to be transferred. Absolutely. That is a requirement. They need to know whether that person can, if it is going to. All right. So I'll give you an example. I had a case many years ago of somebody who had a traumatic brain event, right? And neuro is a frightening thing. The person was covered not on a lowest plan, but on a medium plan. And I think they had a $250,000 exit, annual maximum. When the patient was at the hospital, and this is some of this is conjecture, okay? So bear with me on this. When the patient was in hospital in Cayman, the physicians were eager to get them out of their hospital. It felt like it was a liability to have them there, because they're going to die on us. We need to do our best to get them to the next place where they can actually get care. However, the patient was not stable enough to travel, right? They worked to get them stable. The hospital then put them in a position where they were stable. The overseas transfer process began. And in the overseas transfer process, the first step was to identify the bed the person is going to, because at that point in time, you select your air ambulance based on where you're taking them, right? Air ambulance will not show up if there's no bed to take people to. So you need to get them, identify their case. That physician then communicates with the receiving physician on the other end. In this particular instance, that patient was not, in this particular instance, that person was, the person was in a position where they could not be received. We could not identify a bed. This is a person who was on a plan who could have gone to the United States, and 3 or 4 different hospitals refused them, right? So multiple decision makers are participating in this process, right? So in the end, the person passes away. And the truth is, like, I started this from the outset. It could cost $5. And you could have it in your pocket and you could pay for it and that person could still pass away. But there are multiple decision makers. The air ambulance has to also decide, can I take this person?
Right. Because sometimes they won't, because they have an opinion about whether or not
And I use a brain injury example specifically because the brain injury example is the most expensive care you can access elsewhere. I remember in one instance, we were told that we couldn't get a bed for a brain injury for anything less than $2 million. And the person had $1 million access.
Wow.
So no access for anything less than $2 million. So of course, that's where you get the government involved. The government will decide, is this a Cayman or is it not? If it's a Cayman, then they will actually put up a guarantee in communication with the family, with the DFA. There is not one single person responsible for getting a person off island.
Well, an insurance company, one of the leading insurance companies in the island, said that if it is an air ambulance situation, typically the insurer will coordinate the air ambulance as they want to control costs. The bed acceptance can also be controlled by the insurer, but sometimes they get it coordinated by the referring hospital. But for the most part, the insurer handles everything once the patient referral is approved for medical necessity. FYI, we use our network TPA to handle this, and they do everything, including immigration paperwork and flight management. So that's
this, however, is an added service. It is not a requirement according to Cayman law, and we need to be really, really grateful to our insurers for providing that level of customer service.
Wow. So that's another gap in the law.
Is it though? Because, the market does take up for that. I don't think there's a single insurer who doesn't do that. Every insurer on island does it.
I mean, yeah, but then the patients themselves or family members or employers who are trying to get people off island seem to not even know who's responsible because no one really is. So
but you have to remember, this is a chaotic situation. It is incredibly emotive. When you're in a heightened state of concern, this is where I am often careful to stay out of the way of my TPA, because if I get caught up in the emotions, I can get in the way of them doing their job.
Exactly.
Right. So it is such a highly emotive circumstance, and we just have to have more grace, I think, for everybody involved in this. Everyone in this situation is in a tough position.
Yeah. Thank you so much, Aniki, for coming on the program. Really, really appreciate your contributions to what was a very, very interesting discussion this morning, lending a lot of food for thought for sure.
Bless. Have a good one. Thursday.
Thank you.
Bye.
All right. Make sure to tune in Thursday evening for books. My apologies to Books and Bush Tea. And I got to double check the time, 8:00, I think. But check her schedule on CMR TV. Some great shows on there. People like Aniki doing an absolutely wonderful job. So lots of food for thought. And I think that, it became very, very obvious to me. And I acknowledge that this must be an upsetting situation for all of those involved. But you've got to understand that there are a lot of moving parts to this. Even the air ambulance company being able to say that they are not going to accept or take someone. That's important to know, because we could raise all the money in the world and the air ambulance company goes, nope, she's too high risk. They don't want her dying, or anybody dying mid-flight, because now that complicates their lives, and trying to get them back to, it's like, okay, they've died in international airspace. What do we do with them? Air ambulance companies, they're not in the business of that. So it complicates their lives even more. We can continue to pray for this lady. I think that this is an example of where the Cayman community has really, really come together in an amazing way. Over $200,000 have already been raised. I think they had a goal of over $300,000. The goal was $350,000. It takes time to get there. And what I can tell you, unfortunately, is that the medical facilities, especially in Colombia, you can't send them cash. They want a government-backed guarantee. So I don't really know what the options are for Octavia. It's just a very, very sad situation. By all accounts, she seems to have been a lovely person. And I'm hearing some information, but I can't confirm it in terms of the current state of her condition. So please tune in tomorrow for those updates, because we're really not in a position to confirm that at this time. But I think that even raising $200,000, I saw one donor who remained anonymous donated $10,000 alone. This should be the focus, right? Not trying to place blame on a facility who I can assure you are doing their best with what they're dealing with. And, you got to appreciate what they received as well. I think that at the end of the day, this lends the government an opportunity to think about the transplant program. Why are we still stuck where we are with this? Why haven't we moved the needle? Even for just live transplants, why isn't that at least possible, right? Caymanians and others have to go broad in order to get transplants. And I understand, Aniki's points that transplants are high risk, but also not getting one is a deadly sentence. So, high risk or dead, you take your choice. And I do think that it depends on the types of transplants that are that you're undertaken. But the live one, things like sometimes kidney, which you can get from a relative or friend that's a donor match. We've had Caymanians who've had kidney transplants and they're living their lives still and they're here for longer. So it's not a simple procedure by any stretch of the imagination. It does, involve long operating times, major blood loss, intensive care afterwards. You have to do, lots of medication to make sure that your body doesn't reject certain types of transplants. But, liver transplants, according to the statistics, is in hospital or 90-day mortality rate of 9 to 13% for deceased donor grafts, with much higher risk if the patient was sick with like high MELD scores, heavy blood loss, and multiple comorbidities. So mortality rate 9 to 13%, that's still a lot better than like a guaranteed death. You know what I mean? So I don't know. I think that the government needs to make it possible for people to be able to do transplants here, especially at least start with the live transplants. Kidney transplants have a much short-term surgical mortality rate is much lower. Modern data from high-income systems show 1 year survival for the graft recipient above 95%, reflecting low death rates in the immediate post-operative period. And yes, there are longer-term risk in terms of the body rejecting. You have to be on immunosuppressive drugs, most likely for the rest of your life. And, some of those have serious infection. It reduces some of the serious infections and even some cancers that you can get. So it's complicated. It's not easy. But at the end of the day, if someone feels like that's their only choice to save their life, of course, everybody's on board with, okay, let's do that option. Let's just get it done. So we will, continue to update you on this situation. I think that sometimes people just need to fall back on posting these very emotive things on social media, because I really would have liked to not have had this conversation at this particular point in time. Lavana says that's exactly what I did before I got my second surgery. I got a second opinion from a completely different doctor. And sometimes doctors will differ. I mean, I'll tell you the truth. Before I had my my surgery on my knee, I went to, because a lot of people are like, oh, you know, go talk to the Regenix people, which I think they do a lot of amazing work, right? And so I did go have a consult with them, and I did the PRP research on my own. And the research, not just what somebody claims, the research shows that yes, PRP works for different types of injuries. And there's some injuries that it just doesn't support it. And so when I discovered that I definitely had a meniscus tear, right? And that's what was causing me the severe pain and what needed to be addressed in my knee. There's really only one way to fix a meniscus tear. That was the type of tear that I had in the location, because I've had a meniscus tear in the other knee, but like behind the knee. And the medical experts at that time said, just leave this tear alone. With time and rest, it heals itself. Not every meniscus tear is the same. And not every tear, because it's located in a different place and it's torn differently. And, you know, when I then discovered that the risk for me wasn't just the ongoing pain that I was in, which was constant, but there was also a real risk of it tearing even further and getting worse if I didn't surgically repair it, then I was like, okay, I can't live with this pain any longer. And if you've ever had chronic pain, I remember in August last year, waking up in the middle of the night because I was in so much pain. And I said, I can't take this anymore. You know, I'm not a person that really loves to live up in the doctor's office. I do get my regular checkups because I think it's important for you to know your numbers. I do my annual pap smear, mammogram. You know, so I believe in preventative stuff for sure, because that's going to help you try to get ahead of some of the stuff that's, you know, maybe coming your way. So get your colonoscopy done, do your breast, mammograms, you know, do your full workup, know your numbers, and watch those numbers to see things that might be coming down the pipeline for you. So I absolutely believe in preventative testing as much as possible. But, you know, I don't really enjoy going to physicians just for the sake of going to physicians, right? But when it became, I was in so much pain that literally I was there one night and it woke me up like at 3-4 o'clock in the morning. And I didn't expect him to respond back, but the doctor was up too, apparently at 4 o'clock in the morning. And I messaged him and I'm like, listen, I can't take this pain anymore. Like I'm trying to take pain meds. They're not really helping. I'd have to be on pain meds all the time. That ends up messing with your liver and other stuff. I'm like, doc, can we just book the surgery? I'm going to just have to get it done. I cannot take this pain. And that's how bad the pain was. And, you know, as much as she said that some people just love to live up in the doctor and hospital, whatever, if you've ever suffered from chronic pain and there is a means of relief, you also know that you shouldn't have to suffer with pain, right? And that's where physicians are wonderful. And I think that that's fantastic. And, you know, we rely on them to give us pain relief. And I can tell you now, I'm not 100% pain-free, because if I sit for too long, that's why sometimes I'm here and I'm trying to move the knee and stuff a little bit, you know, I kind of feel like, okay, it's seizing up on me. I need to get up. I need to move. I need to walk, whatever. But it's night and day compared to what I was feeling. Almost immediately, the pain relief was obvious. And as it turns out, Murphy's Law, it's a good thing that he went in there, because we also found some moderate cartilage damage, which he was able to smooth over and try to help with, because then that is contributing to the pain that I now feel. That's actually the source of it. Shannon, good morning, says this is a very important topic, and Aniki is such a great community educator. The patient, the provider, the insurer, and the regulations all have a role to play to bring down the cost of healthcare. You know, and I think that a lot of times, thank you, Shannon, for that. A lot of times the patients, i.e. me and you, we don't understand the role that we play, which is significant in all of this. It's very, very important. Lady D says, we all know for years insurance has been exploited to the max, been told that you need certain procedures when in fact they don't need it for monetary gain, which is pretty wild when you think about it. Thanks, Lady D. Andrew says the more unhealthy people that are put in the pool only create a high premium base for the group. The elderly are susceptible to getting dementia, Alzheimer's, which are conditions that are exorbitantly expensive. Eating healthy costs 3 times more than unhealthy eating. Eating healthy, well, not if you factor in the cost that it's taking on your health, Andrew, which, those are the hidden costs that we don't think about. So you might think grabbing a burger is cheaper than having a good, healthy home-cooked meal or a salad, because you got to buy those healthier ingredients. But I would argue that the longer term implications of eating unhealthy are way more expensive on your health and the health of the entire community. So I wouldn't argue that it's cheaper. And now it's getting to the point where fast food restaurants are charging you what they're charging you because of the cost of food. You might as well eat at home and make it a healthy meal. And drink things like water that literally cost you very little to nothing, as opposed to sodas and stuff. As I say that, I remind myself to take a sip of water. So lots to do in terms of, reform and making some changes. I think legislative changes, we have to demand those are done. Look at the STEP report for folks, see the numbers, because I think the numbers are an indictment on us as a community that we are certainly not doing what we need to be doing to be living healthier lives. Clearly, right? That's a problem. So start walking, start taking care of your mental health and wellness. By the way, I know that we've talked about the shingles vaccine here on this program before. I think it was last year. That I got the shingles vaccine, and I've been encouraging everyone 50 plus to get it done. So if you've ever had chickenpox, shingles is something you can get as a result of having had chickenpox, right? Because the virus seems to kind of lay dormant, and then anything can activate it, stressful events in life, whatever. And then you get shingles, which I understand is really, really painful. They have a vaccine for it, folks. Vaccines in this country come largely, as far as I know, at no cost to you, and they are life-saving. And I know that some of you are confused in your heads because, you felt a way about the COVID vaccine. Even if you feel a way about the COVID vaccine, do not allow that to impact how you feel, because it's based on years and decades of research about other vaccines that have proven effective and have literally saved millions, if not billions, of lives across the globe. Right now, the United States of America, Florida, California, they're having huge measles outbreaks. They just fired the guy the other day who's in charge of vaccines in the country. They don't need to fire him because he was only doing what the leadership of that country, Donald Trump, wanted him to do, which was ignore all medical evidence and good common sense that has proven well for their country and around the globe for literally decades. So now that there's a measles outbreak and it's proven that you shouldn't have hired that idiot, what's his name? JFK's, would he be his nephew? I don't even know what he would have been to JFK, but the Kennedy guy, as health, whatever. He has no qualifications to be the Minister of Health. I know it's not called Minister of Health, but whatever his official title is, he's not qualified for the position. And they're talking a bunch of foolishness. These are the same people during COVID telling you to go and swallow bleach and all kind of ridiculousness, right? So now that they're saying that clearly your anti-vaccination policy is killing your children, killing people, and allowing measles and other things to emerge, polio, and spread, now they want to fire the guy. What are you firing him for? Address it at the highest level of your country, which is where the policy directives are coming from. So don't, something like 21% now of Americans in Florida are getting their kids vaccinated. That's ridiculous. And so many of us end up going to Florida sometimes to live or to vacation or whatever. Be very, very careful, folks. Make sure that your children have all of their vaccines up to date, that you have your vaccines up to date. Going back to the shingles vaccine, there is research that now demonstrates that getting the shingles vaccine actually protects your brain, protects you against dementia. Can you believe it? So it's an added side benefit that they didn't even realize. And the research has supported it. So that's a bit of good news, because God knows with the dementia and Alzheimer's numbers, we probably need every little bit of extra protection that we can get. Andrew says that we have 40,000 work permit holders here in the Cayman Islands. How many of those have pre-existing conditions and are liable to insure as once employed are the responsibility of the employers? They, in return, and out of millions of dollars back home in their home countries, while we spend double when they get sick. Just saying, we have a serious situation that we create. And it's so interesting that Cayman first was trying to even not cover this woman because they claimed that she had a pre-existing condition. I don't know what the pre-existing condition was, but I can tell you that in the early days, time was wasted because they said no, they were not going to cover her, when Health City properly diagnosed it as a liver issue. Because in the first instance, she was sent to them and that was not the diagnosis. So how did they get there? That would have taken testing. You know, sometimes you have to wait days to get test results, right? Not everything is instantaneous. There's some test results that have to be sent overseas. So I get, going back now to where we started, I do get and understand that Amy is very, very emotional about this situation. I understand that, but I don't understand you lashing out against the wrong persons here when you're emotional. That I don't really get. Island Pearl says, I'm just wondering why the insurance do not cover all medications, at least to some degree, even when prescribed by a doctor. Some people cover them at 100%, like injections for chronic arthritis cost $300 plus. Again, I mean, it certainly goes back, Island Pearl, to the type of insurance that you have and what comes with that, right? So it depends on which plan you're with. Some will cover 100%, some don't. The more you pay for insurance, the better of a policy you get. And I can tell you one thing, I mean, my poor husband, he loves his job, and I know that they love having him there. And one of the great benefits of him being with a company that really, they treat their employees really, really well, is that they do have one of the better plans. And I think, in fact, you can choose, because they give them an option to choose. You can choose the best available plan with BritK. So you get really good dental, you get good, vision care, although some of these eyeglasses be costing you an arm and leg, but nonetheless, you get good vision, and you get a lot of coverage for other things, but you pay for that. So yeah, a good chunk of his salary goes towards paying for the family plan, and that one is with BritK. But I tell him it's worth it, because we know we've been in a situation where we had a premature daughter. Thankfully, there was actually nothing wrong with her except she was premature, right? A lot of preemies have issues beyond just being premature. When she hit 5 pounds, they're like, okay, we can't really find anything wrong with her. So it looks like she was just tiny. Let's just take her home and, we'll continue to watch her and her growth charts and whatever. And she's fine. But if you have a preemie with, hearing issues, sight issues, developmental issues, it's going to cost you an arm and a leg. And I remember specifically that there was another couple in the NICU with us at the time. Their little son, Max, I know I've talked about Max before. He's such a handsome little boy. They left the jurisdiction to go back home where she's from in the UK, because they were like, we're not going to be able to afford, once they realized that there was something seriously wrong with him and they got a proper diagnosis. It's a very, very rare developmental condition. So few people have had it. They're like, we're not going to be able to get the care here in Cayman that we absolutely are going to need for him. So they were both expats. The father was from Honduras, the mother from the UK. They decided to move to the UK. Thankfully, they had an option. They decided to move to the UK, where they have their universal healthcare plan, right? And, again, I don't think that that's the best in the world. But when it comes to cost, you're not paying for it directly. You're getting taxed, so you're paying for it in other ways. But a lot of people, if you're used to that system, I guess it sort of works for them. I can tell you, our cousin, when he came here with his wife, she has a heart condition because she had cancer when she was much, much younger. And the type of treatment that they gave her, the radiation, like right basically in her heart, has now caused her to have a heart defect. And she can literally have a heart attack at any time. So there's certain things that she has to do. And she was explaining how difficult it is for her to even get to see the cardiologist. She's like, Sandy, when she started to tell me, I was like, what? She's like, yeah, they literally turned her away. They're like, nope, you're good. Only come in if you're having a heart attack. She's like, what the heck? So it's hard for them to get access to specialists. She's like, it's hard to even sometimes get an appointment. You're on a waiting list for all 9 months to see a physician. Those are the downsides of this so-called universal healthcare plan, right? So it's not necessarily working well for them. And I thought that's so wild. And so she still had a lot of questions. They'd given her medication and they hadn't really even explained stuff for her. Do you know that when she came here, I was able to get her into Health City to see a physician and to just kind of go over, because she had questions, she had concerns. And believe it or not, there were things that they had not told her in relation to the medication that she's taken. For example, she has to actually do follow-up testing to see if the medication they put her on for her heart, because it was starting to do something, but she needed to do follow-up testing within I think 4 months or whatever to see if it was working. Because if it isn't working, she needs to come off of it because it would do more damage to her than good if it isn't working. Her physicians in the UK never explained that to her. They never told her that. So when she heard that here, she was like, what? Really? And he said, yeah, you need to make sure the post testing on this medication is really, really critical. And here's what they should be looking for in terms of the markers and so on. She had no clue. So they were setting her up for even further damage to her heart because they didn't tell her, this is how we check the efficacy of this drug to see if it's actually helping you. Because it's one of those drugs that, harms and helps at the same time. If it's not helping, then we need you to come off of it. And so she was able to sit down with a cardiologist here, go through all of her testing, look at her reports, talk about her condition, the whole 9 yards. And at least she left feeling much more confident that she understood what was happening with her health. She didn't have as many questions because those doctors in the UK were like, nope, you don't need to see us. Don't come in. We don't have time, blah, 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 blah. And it was just like, okay, you're not even a number to them. It takes you a year to get in to see them. And there are literally people dying right in the UK who cannot go in on their what do they call it? NHS, National Health Insurance Service or whatever. They can't get in there. They can't afford, because I guess you can still go to private physicians if you can afford it. They can't afford it and they're dying because, they're not finding cancers until it's too late, all these other things. So I'm saying our system needs work, but it's not the worst in the world. But it does need work, and we all need to play our part in all of this. Lady D says, Sandy, even if they do come, they travel with a doctor who goes to the hospital and assesses the patient before giving the final approval to take them. Your ambulance patients, yeah. Andrew says if the USA makes a declaration that their hospitals will no longer be doing transplant surgeries for overseas clients from the Caribbean, South America, what happens? Well, again, that's only an option for you if you can get a visa to go to the US. And let me say this, some Caymanians don't have that we only have the UK passport, right? Which gives you the ESTA. And remember there was some debate for years on how you couldn't travel air ambulance on your ESTA. And so the lesson today is ensure that you know your limitations. Everything from the type of insurance coverage that you have to, your travel restrictions, make sure your passports are up to date. If you have to quickly get off island, what are your options, right? Let's make sure that you know how you can get off. Because some of you only have that UK passport now. So think about it. There is a real consideration here. In any event, yeah, I mean, it's crazy, right? The people don't think about these things till they're in an emergency situation. Even the situation, poor Austin, I think most of us know that he had to be air ambulance off. And the thing about that is, again, ironically, that weekend that they were air ambulancing him off, guess what? It was, NAU is closed, Cineco is closed, this one's closed, that one's closed. What's going to happen to poor Austin? How does the Cayman even get off island if these entities are closed? It's holidays and weekends and whatever. We need the paperwork to prove that he's Caymanian. I can tell you that the minister herself had to step in and say, no, send him overseas now. We know he's a Caymanian. We'll get you the paperwork later on. Let's just get him overseas on this air ambulance ASAP. And he barely made it on the air ambulance. They had difficulties with him in the air. So I'm just saying, these things happen. Air ambulances are obviously a very, very precarious, situation. And sometimes you're in the air ambulance and you don't even live to get there en route. Jenny says dementia is actually type 3 diabetes. Excessive carbohydrates consumption is the primary cause. So there is some research that is, and some people who are definitely leaning in that direction, that those are probably more than likely lifestyle related things as well. People talk about Trump saying he's going to attack Cuba and how close we are. Well, at this point, anybody's for a game for Trump, so who knows? But yes, he's forgotten about Iran already. And he's been talking about Cuba. By the way, gas prices gone up well over $120 a barrel now. So sit tight, folks. It's going to be a long couple months. And he's telling y'all not to worry about it because it'll eventually come down. Well, yeah. We have a few more comments here, and then we're going to go ahead and wrap this up. Let me just see here. Okay. My apologies. Oh, we got to start our squats back again. We've been slacking. All right. This person says the Philippines provides a national health insurance program called PhilHealth, which is mandatory for all citizens and legal residents. Aiming for universal coverage. Funded by contributions, it offers basic inpatient, outpatient care, though it often requires out-of-pocket payments for services. It is funded by mandatory contributions from employees, employers, and the government. And while it covers basic needs, it may not cover the full cost of complex procedures, leading many to use private health insurance or HMOs for better coverage. And unfortunately, a lot of the people there cannot afford private health insurance. So this person says your next insurance topic, explaining to public that CIG departments have to pay Cineco for coverage for employees and the families, and at premium coverage because they don't have SHIC for CIG. Really? Huh. Okay, well, you certainly learn something every day because I didn't know that. Interesting. Also keep in mind, DFA provides Cineco for indigents, etc. Thanks for this. I hope work permit holders, especially, are listening, as most don't understand. A question I have is, why is the outpatient doctor visits and meds is so low for SHIC for $400 or $500 annually? So that's the coverage. Ay. No, she did not recommend the UK model. Yeah, she said that she didn't support national insurance. Yeah. A person says, good morning. Thank you very much. As a poor Caymanian, I should know better than asking for help. God bless you all. This is someone who, I'm asking for your help. I'm a 60-year-old man. I was terminated on the 11th of August, 2025 for no reason. I called out to the labor board 5 months and they replied to me is in the process for the last 4 months and no reply back. Could you look in the matter for me? Thank you so much. I have an 11-year-old boy going to school and no help. His mother run away and left him and me alone, and I have no job, so that is why I'm asking you to look into the matter. Okay, so the first thing you need to do is to please contact DFA for assistance. So you found yourself unemployed and in a financial situation. That's who you need to contact. I mean, I can talk about, these people, and I don't know the situation, but I can talk about them, you say for no reason, terminating you. But you've also sent me a letter dated from August where they gave reasons for why they terminated you. So I am not in a position to argue with whether you did those things or not. Right? So they say that you were previously issued a written warning regarding your performance and conduct. And despite this, further issues have been documented, including but not limited to. And then they listed 3 things: failure to properly record and update maintenance requests into the system, creating the appearance that assigned work was not performed, inappropriate remarks regarding your employment, including stating that if the schedule cannot work, then Frank will have to fire me, which constitutes insubordination. Well, I guess Frank did fire you, whoever. Continued resistance to adhering to the scheduling requirements of your role. These actions reflect a pattern of misconduct and failure to meet the standards of performance and professionalism required in your position. And so they fired you, gave you your final pay in August of last year. I mean, it's unfortunate that as a 60-year-old, you find yourself, you can't say seems they gave you reasons. You can't say you were fired for no reason. They already had written you up and then they gave you reasons why they fired you. Let me be very, very clear here, folks. When you have a job in this day and age and you want to keep your job, you got to do what it takes to keep your job. If you got other options and you can afford to walk off the job or you can afford to have them fire you, then that's a different story. But if you can't afford to have them fire you, perform. Your employers have things that they need you to do in a specific way. You're not self-employed. You can't do it how you want to do it when you work for other people. So as much as I try to, really go to bat for the employees are not always in the right. Sometimes y'all are out here messing around and messing up. And what do you want me to do? I can't give you right if you're wrong and vice versa. I don't know what to say, but I can't. These are not situations that I can fix. Y'all need to help yourselves. And the best thing in the world that I can do is show you how to help yourself. That's the truth. And sometimes that means telling y'all the cold hard truth that you need to just get your shit together. I'm just saying. Okay? They gave you reasons. You can't say you weren't fired for no reason. The reasons are right in the letter that you sent me. What a mess. Become self-employed if you think that you can't work for other people and you know how to do it best. You're going to have to become self-employed. But I can guarantee you, normally by the time you're 60, that is more or less going to be a pipe dream. So I don't know what else to tell you. What a hot mess. Anyway, folks, I'm going to go ahead and wrap up there for the day. Please have yourselves a good day. It is Monday. Please be safe on the roadways because, again, the number of car accidents that we're having, it's crazy. And yeah, I don't know what else to say. But it's pretty wild out there. And again, all of us are paying the price to have coverage for, car insurance. So we still don't have to talk about that, right? The amount that we're paying in car insurance premiums because of the bad drivers out here driving left, right, and center. And the sad thing is, a lot of those people can't even afford, like when they hit your car, but for insurance, they cannot afford to pay for anything. So it's like, you would think that they would be that much more cautious on the roadway because they can't even afford it. What a hot mess. All right, folks, have a beautiful day. See you tomorrow morning. And we'll pick up the conversation on these important things. And I can tell you that we will be reaching out to, the government, especially when it comes to the transplant situation, to see what more we can find out in terms of what it is that they're planning to do to move the needle. They've said, yes, we need to do transplants, but yet we can't hear any more and what's actually happening with it. So that's pretty crazy. All right, folks, be blessed, not stressed. Take care for now.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.